Hey, I'm Dr. Caudill Miller for Dr. Miller's Guide to Neurology. And today we're going to talk about hemifacial spasm. Hemifacial spasm is a rare neuromuscular disease that manifested by involuntary contractions of one side of the face. It's sort of like this. Can you imagine just doing that all day long? How horrible that would be. The cause is unknown. What we call idiopathic, which means unknown. 77% of the time we do not find the cause, but you see it with trauma. You see it with demyelinating diseases like MS, and you'll see it occasionally with a brain tumor. So we always do an MRI of the brain with or without contrast with CP angle cuts, which are cerebellar pongene angle cuts, little 3 millimeter cuts to this part of the brain, the cerebellar pongene angle. You know, in the old days, I remember treating this with anticonvulsants. We started out with Tegretol, then Trileptal, then Lamictal. Just none of it worked. Sometimes we would add Botox. It was very frustrating. Then suddenly Botox came out. Now when you hear Botox, people just start cringing. They think cosmetic Botox. But even cosmetic Botox, if used appropriately, is very effective and works very well. But 20 years before we started doing cosmetic Botox, we were using Botox for dystonias like hemifacial spasm. It just works amazing. What you do is you put a little bit here, a little bit out here and around the eye, and a little bit out here. Now you got to be careful not to put it too far where the facial nerve comes out because you can paralyze the smile. You definitely don't want to put it in the midline because it will paralyze the orbicularis oculi. So right here in the midline, it will paralyze this muscle and you'll have ptosis or a drooping eyelid. This will last as long as the Botox lasts. So you can have a drooping eyelid for 3 to 6 months. So make sure when you get this done, someone does it as experienced because you don't want to have facial weakness or ptosis. It just works great. It lasts about, 10 weeks to 6 or 7 months. Everybody's different. We usually do it for hemifacial spasm every 3 months. It's the only effective medical treatment and results are amazing. So if you have trouble getting pre-certification, you need to fight this and have your doctor fight this because it's the only effective medical treatment. We have a surgical treatment if Botox doesn't work. Microvascular decompression is a major surgery, a craniotomy where the neurosurgeon goes in and dissects the facial nerves, usually a corkscrew-like collection of blood vessels around the nerve. So, hemifacial spasm. Now, if you've watched this video for the second or third time, you can just cut me off now, but make sure you comment and like my video and subscribe. For those y'all are watching for the first time, stay on for just a minute. Let me tell you what I'm going to be doing. Now, I'm a neurologist. I've practiced for 40 years. I have a little book called Dr. Miller's Quick and Dirty Guide to Clinical Neurology, which is unpublished, and I'm working on the 7th edition. When I was younger, I worked in neurosurgery with my father, and he taught in groups of 3. I thought it was pretty innovative. The residents would come to his office and get the handouts. He thought doctors were too stupid to remember anything but 3 things at a time, so he had everything outlined in groups of 3. So when I went to medical school, we all were given this little blue book, and I made notes and then put it on index cards, which I later gave to my son. And when I was training nurses, I would write each day when we see a condition, I'd write on an index card. Then a friend of mine at Kinko said, I think this is pretty cool. Let me put it in a little book. And we did this about 7 years ago. And I thought it was great. And so then myself and Dr. Shashi and Paige Harris, one of the nurse practitioners and one of the internists, we really took it seriously. We're now working on the 7th edition. So what we're going to do over the next decade is document everything that I know in clinical neurology, things that actually are happening in the office, disorders that we see in the office, and how we're treating them in that moment in time. And so I'll be posting more videos, and just comment, like my channel, subscribe so I can grow the channel. I look forward to seeing all y'all. Thank you.